Hi, I'm Dr. Tyler. I'm a newer doctor here at the Chiropractic Healing Center. I've been coming here as a patient all my life since I was about 4 or 5 years old. Um, this is Dr. Harding.
Hey, I'm Andy Hart. I'm a chiropractor. I've been here since 1989. A lot of you weren't even born back then, but I've been practicing since 1989. Love what I do and got a great team now. So this is Dr. John.
Yeah, I'm Dr. John Braithwaite. I've been practicing since 2007. I've been here in Kansas City since 2022 and just love here serving here in Kansas.
All right, so here's the reason why we're making this video. You have signed up to come in to see us, and we just want to introduce ourselves and make sure that we're on the same wavelength as you. A lot of people go to different chiropractors and been to chiropractors before, and this may be the first chiropractic experience for you. So we just wanted you to know and understand what we expect when you come in to make sure we're on the same wavelength. Okay, we're kind of a unique practice in that we're a busy office in a lot of ways, and one of the reasons why we're busy is we just do one thing. We do what's called principal chiropractic. And Dr. John's going to explain what principal chiropractic means.
So the core basis behind principal chiropractic is we focus on adjusting the spine, and that's all we do here in this office. Is that we adjust what's called a vertebral subluxation. Subluxation is misalignment of the vertebra that could affect the communication from the brain down the body. And this is an example. This is a little model here, and there's research shows that 96% of infants at birth have a misalignment up here in the top bone, this C1, C2, that interferes with the communication from the brain down to the body. It actually increases to 98% if any kiddo had a C-section, in the process of the birth process. And so what we do is we look for these vertebral subluxations and then correct those so your body is able to function as close to its optimum as possible so you can live a full healthy life. And that's, in a nutshell, principal chiropractic is.
Again, so most people start under care for pain. They come for one reason, and it's pain. But what they don't realize is the cause of that pain is one of these vertebral subluxations. So Dr. Tyler is going to explain a little bit more about what these subluxations look like and how they affect your body. Because again, nobody's ever died of back pain or neck pain at all, but they have died of internal organs failure of certain sorts. And a lot of times these subluxations can lead to that. So Dr. Tyler can explain that to you, okay?
All right, so this here is a 5'3" male spine model. So we have discs here, and then the vertebra here, and then these yellow nerves here are the nerves. So your brain sits up here and controls and coordinates every function in your body. So when a subluxation occurs, that causes tight muscles and not allowing the joint to move properly and can cause pain. Those are some of the symptoms you can have. Um, that causes disruption with the brain's communication with the body, and the body isn't able to communicate with the brain properly. So all these nerves go to different parts of the body and help coordinate and control different functions. Okay, so these nerves here, 50 to 200 million tracts are in each of these nerves throughout the spine, and only 5 to 9% of them have anything to do with pain or pleasure, allowing us to perceive that. So that means we can have a subluxation for a long period of time before we even are able to feel any symptom, any pain. Okay, so it's very important to get your spine checked so that way we can avoid that. So I'm going to look at the chart behind me. This is our Merrick chart. So it shows each nerve spinal level throughout the body, where it goes and coordinates and controls in the body. And then if there's a subluxation there, you can have certain symptoms that can occur. A lot of the main ones that we see in our office are a lot of people with headaches that can deal with the number C1, the top vertebrae in the spine can be out of alignment, causing those headaches. We see a lot of people for we need to make sure we're getting T1, T2 checked that goes to the heart. So if that brain to body and body to brain connection is not there, then you can have some problems with the heart. Another one is the stomach, another important one. People have stomach ulcers, heartburn, indigestion. If we are able to restore that communication, that could possibly help with some of those things that are going on. Liver, adrenal glands, kidneys, bladder. We've had patients come in that have kidney issues, that their kidneys aren't functioning properly. And they get under care and get under chiropractic care and allow that brain to communicate with the body better, and their kidney functions start to function better than they did before starting care. And another one, reproductive organs. very important. Um, Digestive issues. So getting checked is very important, and make sure that we're clear and the body is communicating well, and that way you can live a vibrant, healthy life.
So it's a lot like diabetes or blood pressure. You don't have to have symptoms to have a subluxation. In fact, pain's like the last thing to show up and the first thing to go away. And so a lot of people have been to chiropractors and say, hey, I went there and he adjusted me 1 or 2 times. Or maybe he didn't even adjust me. He did some acupuncture. He put me on some rollers. And he got me these red lights and these lasers and decompression. Again, we're a principal chiropractor. If you need physical therapy, we're going to send you to physical therapists. If you need nutritional advice, we'll send you to a nutritionist. If you need acupuncture, we'll send you an acupuncturist. That's all they do. All we do is detect and correct these subluxations. And if you notice when Tyler was talking about that, even though you may come in with low back pain, with pain down the leg, or stiffness in your lower back, most all of us have stress. Most all of us live in front of our phone or in front of our computer to a degree. And that upper back and neck get tight and stiff, and it can and will affect all those things he's talking about. Head colds, sinuses, headaches, upper back can lead to heart conditions and things of this nature, breathing conditions. So again, pain's the last thing to show up and the first thing to go away. And we can't tell you over the phone or on this thing how long the care is going to be. The research shows, just like braces on your teeth, the research shows it takes 14 weeks of multiple adjustments a week to make a correction of a subluxation. Add a week for every year from the original injury. And I'll be honest with you, like me at 61, if I had a new pain and problem and I went in and looked, I was injured in a football injury way back 40 years ago, it would take 2 years of every other day getting adjusted to correct that stuff. So I'm not going to get that corrected. What I am going to do, I'm going to get it managed. We're going to get you out of the soup, out of the trouble, whatever that means. Maybe daily for a day or for a week, and maybe 3 times a week for 6 weeks. It's just too early to tell. We'll do a great adjustment or a great examination and assessment. If we need x-rays, we'll take x-rays, see how much damage is inside there. And once we come up with a plan, we'll get you a plan to get you started. But we want you to know ahead of time. It may be 4 to 6 months of consistent care to get you back to maintenance care. But the bottom line is we want to change. We want you to know and understand what we're here about. Okay, what we want you to do is we will make it affordable. I promise you. Every man, every woman, every child needs what we have to offer, and we're going to offer it to you at a price that you can afford. I promise you that. The main thing is I want you to think about everything we just said here. If you understand this and this seems right for you, sign up. We're glad for you to join our family. We'll help you as much as possible. I promise we're going to work as hard as we can to get you the care you need at a price you can afford and get your lifestyle back to where you have your function back. And then we'll maintain that hopefully till this guy retires, okay? But the bottom line is, if this doesn't resonate with you, if this sounds like too much a commitment for you, that's okay. Just call the office back and cancel your appointment, or call the office back and ask me, and I'll refer you to somebody else who's willing to just say, hey, we'll crack your back a couple times and kick you down the road. That's just not what we're about. We're about here to detect and correct those subluxations and maintain that and make your life better. If that resonates with you, we're ready to start with you. God bless you.